Welcome to the deep dive. Ever looked at a medical bill and just, well, scratched your head, wondering how seeing the doctor turned into this pile of confusing papers and charges?
Happens all the time.
Right. So today we're pulling back the curtain on that whole journey, the hidden life of a medical claim. We're using your sources, and our mission is to kind of demystify how that visit becomes a bill, or maybe a payment, or sometimes, a denial. And this whole intricate process, it affects pretty much anyone who uses healthcare. It's definitely more than just, here's the service, here's the charge.
Yeah, and it's easy to just think, oh, it's about the money, but really, it underpins the whole healthcare revenue cycle. Understanding it isn't just for the clinics or hospitals. It's foundational for your empowerment as a patient.
Empowerment, okay. How so?
Well, it gives you clarity, right? On what you owe, why you owe it, and connects back to the care you actually got.
Okay. Let's start at the very beginning then. What's kind of surprising, maybe, is that the first big step happens before you even see the doctor. Patient registration and insurance verification.
Exactly.
That's where they get your basic info, your insurance card. Why is checking that stuff beforehand so critical?
Well, it's all about making sure your coverage is actually active and that you're eligible for the services before anything happens. Think of it like a gatekeeper.
Ah.
A surprising number of billing problems down the road, they could actually be stopped right there at that first step.
Really? Just by checking the card?
Yeah, confirming the plan is active, understanding maybe what it covers roughly. It just helps avoid those nasty surprise bills later.
Okay, makes sense. So, all right, visit's done, insurance checked out fine beforehand.
Huh.
But how does, the chat with the doctor or that blood test turn into something the insurance company understands? It feels like they speak a different language.
That's actually a great way to put it. It is kind of like a secret language, and it's all based on codes. You've got CPT codes, that's current procedural terminology for the procedures, what was done.
Okay. CPT for procedures.
Then there's ICD codes, International Classification of Diseases for the Y, the diagnosis.
Diagnosis.
And sometimes HCPCS, Healthcare Common Procedure Coding System for other things like medical supplies, wheelchairs, maybe certain drugs.
Wow.
Think of them as like the universal translator for medicine and billing. Without them, yeah, it's chaos. Errors in these codes, that's a huge reason for rejected claims or weird bills.
Okay, that coding part sounds super important. So once it's all coded up, is the claim just, fired off? Or is there another check?
Good question. There's actually a really vital little pit stop called claim scrubbing and validation.
Scrubbing, like cleaning it.
Exactly. Before it even goes to the insurance company, usually special software checks it for mistakes. Missing codes, maybe the diagnosis doesn't match the procedure, patient info typos, formatting stuff. And get this, a huge chunk of initial claim denials. They're because of simple errors that this scrubbing process catches.
No kidding.
Yeah, so it's not just about being neat. It prevents a whole mess of back and forth delays for everybody. And most claims now are sent electronically through something called a clearinghouse. Way faster than the old paper way.
Okay, so our nice, clean, scrubbed claim is finally sent. What happens when it hits the insurance company's system? This still feels like the real black box part for us patients.
It absolutely can feel that way. So it enters what's called payer processing. The insurance company, the payer, they review everything again.
Again, what are they checking now?
Well, they double-check your eligibility for that date of service. They look at the medical necessity. Was this procedure really needed for that diagnosis? And they verify those codes again. This is also where they apply their contract rates. That's kind of like the discount your insurer negotiated with the doctor or hospital. And, of course, your plan's details, like your deductible. Have you met it yet?
Right. And then what? Approved or denied?
Pretty much. Two main outcomes. Approved, which means they figure out payment, or denied or rejected. And denials often loop back to those errors we talked about, or maybe the service just isn't covered by your specific plan.
Got it. And then the moment of truth arrives in the mail or online. That explanation of benefits, the EOB, or maybe an ERA, electronic remittance advice. This feels like where it gets really real for us, right?
Definitely.
What's the number one thing we should zoom in on when we get that piece of paper?
Yeah.
Or, PDF?
That document is your main window into that black box. Honestly, the most crucial thing for you, the patient. Look for the line item that says patient responsibility.
Okay, patient responsibility.
Yeah. That tells you exactly what the insurance paid, what they didn't pay, and crucially, why. And then what you owe. Your copay, maybe coinsurance, or whatever's left of your deductible.
Right.
Always good to check the service dates and maybe those CPT codes against your own records too. Make sure it matches the visit you remember. It's your guide to understanding your share.
Okay. And if there is a balance under patient responsibility, that's when the actual bill from the doctor's office usually shows up.
That's typically how it works.
But what if the claim was just flat out denied on the EOB? It's just
Sure.
game over.
Yeah.
Do I just have to pay the whole thing? My first thought would be to just toss it in the too hard pile.
Oh, definitely don't do that. A denial is often just a bump in the road, not usually a dead end. Providers have whole teams usually dedicated to follow-up and appeals.
Oh, okay.
Many times, a denied claim just needs a small correction, maybe some missing information, and it can be resubmitted. Or if you and your provider think the denial was wrong, it can be formally appealed, often with extra notes or records to support it.
So you can fight it.
Absolutely. And that really highlights why knowing even a little bit about this process is so empowering for you. It helps you ask the right questions and, advocate for yourself if something seems off.
So yeah, from that first registration check through the coding, the scrubbing, the payer processing, the EOB, we've seen it's quite a complex journey for a single medical claim. Lots of steps, lots of places things can go sideways.
Exactly. Each stage is crucial. And understanding those steps, even basically, is really key for your empowerment as a patient. It truly helps you manage your healthcare costs better and feel more confident asking questions or, like we said, challenging a charge if needed.
So here's something to think about. Next time you get a medical bill or you open up that EOB, knowing what you know now, what specific question might you ask? Or what detail might you look for differently now that you've journeyed through the life of a medical claim with us?